Good afternoon, everybody. I'm sure you have had a very nice lunch and ready for the next session. It's a very important session about the effect of intimate partner violence on children. My task is very simple. It is to introduce the next speaker, and the next speaker is Silvia Pasti. From little I know about Silvia Pasti in a short while, and having read her details, I'll tell you she loves children, and she loves children to be happy, playing, reading, and that is why it makes her special in having a role in UNICEF, in her role as an advocate or an administrator in children's health in terms of intimate partner violence. That's number one qualification. Number two is she has experience of over 15 years working in the UNICEF in relation to child protection. And she has worked in countries where if you listen to the names of those countries, you will know why it is so important to have a person of rich experience like her here. She's worked in Madagascar, Pakistan, Guinea, Yugoslavia, Romania, and for the last 6 years in South Sudan and Uganda. Currently she has about 12 subordinates working under her, and their main role in Uganda is to mitigate, prevent, and also foresee emergency situations where intimate partner violence and violence which may affect children in emergency situations. She has various diplomas in law and sociology from Romania, and she has a master's degree in international management from University of Liverpool, UK. She has been in various positions, including a general director of Ministry of Social Protection in Romania. With this short introduction, I would like to invite Silvia Pasti to tell us more about the effects of intimate partner violence on children.
Good afternoon, and I will start with a confession. The first time I'm in a meeting, in a workshop, where the participants that are in the workshop I never met. For me, it's a great opportunity to have this chance of meeting with you and having interaction with people that work in universities, academia, research institutes, and not only. The discussion so far in the morning sessions was very, very enriching for me, and I hope that my presentation will also contribute and enrich the discussion for the rest of the day, and I hope also tomorrow. I have been introduced, I'm the Chief of Child Protection in UNICEF Uganda, and yes, I have more than 15 years of working in UNICEF in child protection in different countries. And for UNICEF, child protection means really protecting children from harm, abuse, violence, exploitation, and neglect. And I know that my presentation should be about the effects of IPV on children, and so I've done my best to really make a presentation that talks about that, though we don't have really evidence and studies to show what is the impact on children's lives of the intimate partner violence. So my presentation next has these 4 areas. What do we know? Data on violence against children, what is the current response and what are the limitations of the current response. Next. So first of all, you know, we are using different terms, and these terms are well defined, but in Uganda, the main term that is used is domestic violence and also the spousal violence. And we heard in the morning that there is a difference between the definition of WHO of intimate partner violence and spouse violence, but I don't have data according with the definition of WHO, so allow me to present the data that exists officially in Uganda. And the data that are on the screen, the source of data, is the Demographic Health Survey 2011, and I wanted to stay with this official data because I think it's important, because if these data are official, they are also endorsed by the government, by the country, and you can work with those. So as you can see there, more than half of the women and even men age 15 to 49 have experienced physical violence, and 28% of women and 9% of men have experienced sexual violence at least once since their age of 15. And in terms of married women, 56% of those have experienced physical or sexual violence by current husband or partner. And the most common perpetrators of physical violence against never married women are teachers, followed by fathers and mothers, and of sexual violence are strangers, followed by friends and relatives. And in addition, 60% of pregnant women aged 15 to 49 experience physical violence during pregnancy. So only if we look up this data is telling us that violence is it's a continuum during the life span of a human being, and sometimes starts before the child is born. And I think that this is really very worrying. And though we are talking about the intimate partnered violence and the effects on children, we cannot ignore what is happening in the society at large. We also, I think also that the data is telling us that there is this power imbalance between men and women, between boys and girls in Uganda, because when we look at the perpetrators, we see that the majority are men, even for never married women. And also, though even men are victims of physical violence and a smaller percentage of sexual violence, the perpetrators, as you'll see in the next slide, are others, not necessarily the spouse or the wife, though it's happening that also. So in terms of spousal violence, it's highest among those whose husband has no or only primary education, whose husband get drunk very often, who are better educated than husband. So if a woman is better educated than husband, this becomes also a liability for the woman, as she's at higher risk of violence, and who are 1 to 4 years younger than the husband. So I think that these are factors, again, these are data from DHS 2011 that should be taken in consideration in trying to highlight the determinants or the drivers of violence between husband and wife. Also DHS shows that the violence from the intimate partner starts early in the marriage, the violence against married women. And 30% 57% of women who had experienced spousal violence suffered one or more form of injuries, and 40% of them suffered serious injuries. And I remember it was a question in the morning about how serious are these injuries and how we can link this with the cost of violence, economic cost, but also the cost in terms of the health sector. But on top of this, there is a high level of condoning of violence. And there is a publication of an NGO that does a scorecard every year in terms of the violence against women around the world. And unfortunately, Uganda, in terms of condoning of violence, Uganda has, I guess, the highest prevalence in terms of the reason for which violence is condoned. So women agree that they should be beaten if the husband is not happy with the wife, and the wife argues with the husband, and 40% of women agree with that, and 31 women and 90% men agree that wife beating is acceptable if a wife refuses sex with her husband. And really, when you look up this prevalence and you see what is happening in Pakistan or India or Afghanistan, that we know that probably these countries have higher prevalence of physical violence, but in terms of condoning, is less than in Uganda. You also have to take this in consideration. And as I said in the morning, I think that a lot needs to be done to change the aspiration and the expectation, and that this should start early in the life of a child. Now, besides this data on violence, I put also on the screen some additional data that I think that are important in our discussion. One is that 49%, so almost half of women of Uganda get married before the age of 18, and 50% of them get married before the age of 15. And of course, once they are married, we know already that the risk of being victims or exposed to violence it's higher. 24% of teenage girls, besides those that are already married, have started childbearing. And then when we look at the cases of defilement, and that has been said in the morning, the last police crime and traffic report mentions that in 2013 there were more than 9,500 cases of defilement reported to police. Not all the cases, just those that reported. But since 2010, when there were only 7,360 cases of defilement, there is an increase of more than 2,000 cases. This means that about 26 girls per day are defiled in Uganda. And defilement is a serious violence against girls, isn't so? Also, in a study that has been conducted by Ministry of Education with UNICEF support in 2012, 77% of primary school children and 82% of secondary school students, those that have been interviewed, declare that they have experienced sexual abuse at school. And also, I didn't put it on the screen, but the girls are saying that the main perpetrator of sexual abuse in school are teachers. And also in another study that has been conducted by Makerere University with UNICEF support for the Ministry of Gender, Labor and Social Protection, 40% of children suffer physical violence that left a mark on them. So again, this additional data, I put them on the screen because I think that they provide a better understanding of the context in which this intimate partner violence is happening, which is just a form of violence. Also, UNICEF has launched in June a child poverty report. That because, yes, Uganda has made tremendous progress in terms of reducing poverty measured in terms of income. So less people in Uganda are living under the poverty line or in extreme poverty. But we know already that the poverty affects differently children. And some of the indicators there, such as stunting, meaning children that are not according with the height that they have, and stunting is a proxy indicator for development in a country, it's still at 33% of children in Uganda are stunted. And also when we look at the percentage of children that actually complete primary education, though 99% of children are enrolled in primary education, only about 60 or a bit less than 60% complete primary education. And there is a big gap between boys and girls that complete the primary education. So when we put this data on violence with the data on poverty and the impact of poverty on children, and together with what is happening in the education sector, and of course I can refer also what is happening in terms of the health sector with maternal mortality that still remains very high in Uganda, malnutrition that remains high in Uganda, the infant and under 5 mortality. So this to me, or from my point of view as UNICEF, gives a more comprehensive picture of what is happening in Uganda. And then in my mind, this means that also the discussion on intimate partner violence and what should be done in terms of the way forward should also start looking of this issue. And the last data that I would like to share with you, it's about birth registration. So the DHS of 2011 have shows that only 30% of children under the age of 5 are registered at birth. So all the data that we are using, the statistical data and the denominators for establishing rates and prevalence and so on, are a bit, to my opinion, a bit, not strong enough, because it's just, based on the census 2000 that has been conducted in Uganda, that the population, including of children and adults, it's established. So not having strong birth registration and CV registration in Uganda, it's another determinant when we are talking about violence, because if we don't know where are these children and adults, also because as children they have never been registered at birth, it's a bit difficult to have good programs and intervention. In terms of the effects of domestic and spousal violence on children, so I'm just looking, yeah. Though there are no statistical evidence in DHS, we know from the work that we are doing that the violence, it's intergenerational, so it goes from one generation to another. And in the module on violence against women in DHS, there is a question about those that perpetrated the violence against wives or husband, if they came from a family that where the husband or the partner used to beat his wife. And it seems that a high prevalence of those that continue doing the same actually come from these families where beating the mother or the wife was common. Also, in terms of breaking down of families, many women actually run away from a very violent husband, and as it was said in the morning, they have to leave their children behind. They can't take their children with them. And of course, the man will get another wife who will actually abuse and exploit these children. Also, we know already that physical violence against children in school and sexual violence against girls in school are major causes of school dropout. But again, there are no national data evidence on that. It's based on the work that we are doing and the reports that we are receiving from the field and some of small studies that we have done. So in terms of what has been done so far, yes, Uganda has this domestic violence and the Child Act, and they provide a good legal framework, but again, in terms of the implementation, I guess that we are behind other countries. There is a saying in Uganda that Uganda has very good laws and Rwanda takes these laws and implement them, but not in Uganda. Also, in terms of the program and projects, already has been mentioned this gender-based violence and gender equality under the leadership of the Ministry of Gender, and there are several UN agencies that are actually working on those with the government at national and district level, UNICEF being one of them. There is a child helpline that is owned by the Ministry of Gender, Labor and Social Protection, has been launched in June. Has a 3-digit free of charge phone line, and anybody can report the cases of violence. And we have seen a lot of cases that have been reported since then. Also, I know that there is also a helpline that UNFPA is supporting for reporting the violence against women, and also UNFPA is supporting the ministry to have these centers, shelters for women that run away with their children because of the violence at home. Also, there are a lot of initiatives and intervention at the community level, supporting communities to start the process of changing the social norms that upheld the discrimination and the violence both against children and women. And there are already evidence that such kind of work of changing these social norms gives results. But I think that this should be better documented, and also the question is how you take up to scale such kind of good results that are just in few districts and few communities in Uganda. Also, in terms of the violence against children in schooling, including the sexual violence, with UNICEF support, there are hundreds of schools that have what is called EduTrack, where the cases of violence not only are reported to the Ministry of Education through SMS using mobile phone. The government, with the support of UNICEF, is in the process of developing a national action plan on violence against children in school. And also, we are in the preparatory phase of having a survey on violence against children in Uganda. Next, limitation. So despite the good progress that has been done in Uganda in terms of addressing both violence against children and violence against women, we don't have yet clear and comprehensive evidence of the effect of IPV on children in Uganda. Lack of economic and social cost analysis of IPV on both women and children in Uganda is missing, and I know that has been said in the morning, but this means that it's important, not only to me. The health management information system does not collect data on IPV, and also the management information system of police and judiciary also does not collect data on IPV. And because both these ministries actually have routine data collection from lower level to the national level, I think would be important if indicators related to IPV are included in what at least these two institutions are reporting. And of course, there is very limited funds allocated by the government to violence against women, children, and IPV. Thank you.